Perfect. Sorry, everyone, for being 5 minutes late, but we're going to get started. And then as everybody keeps trickling in, I will go over just a couple of housekeeping items. And sorry, this is GoToWebinar platform, which is pretty much like Zoom and other platforms. There will be no audio for the audience. Please, to join the audio, choose your microphone and speakers that you use the voice over IP, or call in the telephone and dial in number that was sent to your registration confirmation. Please submit your questions and comments via the questions panel. If you have any technical issues or difficulties, please reach out to me in the chat box or Alicia Lopez. Please note that today's presentation is being recorded and will be provided once it's available. For those of you who are registered, you will receive a follow-up email with the recording directly from GoToWebinar, but I will make sure that I send an email follow-up as well to all of you who are joining us. Then next, that was it, and here is Mark. Oh, sorry, that's Mayor Ross, please.
Thank you. Good morning and welcome, everyone. I'm Greg Ross. I'm Mayor of Cooper City, and I'm also the immediate past chair of the South Florida Regional Planning Council, and my most recent title is the second vice president of the Florida League of Cities. And I do welcome everyone to what I do say is an honor for me to moderate. It's today's webinar. And I want to say thank you again to the South Florida Regional Planning Council for putting this on. We have the problem, as everyone does. COVID-19 has spread around the world, and in our region, the outbreak has had extensive effects on people and businesses. There's an urgent need to understand who has been affected, how they are affected, and how local and regional governmental entities can help coordinate resources to provide support. Joining me today for a conversation is both the Broward and the Miami-Dade County mayors, who will tell you the biggest issues facing each county and how the American Rescue Plan funds will be applied. You'll learn what the counties are proposing to implement as economic recovery and resilience plans for the region. But first, we've got Mr. Mark Cassidy, Economic Development and Research Manager of the South Florida Regional Planning Council.
Mark, you on?
Thank you very much for that introduction, Greg. I'm on. I'm being told by my GoToWebinar that my connection is a little bit poor and it's
Now we hear you fine.
My face off today, so I won't be able to share my mug with you. Before I give our mayors a chance to discuss their plan, we thought it would be good to give an update of the council's mission and the services that we provide. And I think somebody's not on mute. Great.
If we
I'm
can,
just going to give an
Rhonda, if we can have everyone muted.
Well, all of the audience is muted, so I think, Mark, you want to I think your microphone is acting up probably.
I don't know how that could be, but it sounds okay. So
Now
we'll move forward.
All right.
So the council's mission, we've been in existence since 1974. Our mission is to identify the long-term challenges and opportunities facing Southeast Florida and assist our region's leaders developing and implementing creative strategies to result in a more prosperous and equitable community in our region. We also strive to make a healthier and cleaner environment and more vibrant economy. The council represents Monroe, Miami-Dade, and Broward through regional collaborative planning, and we are also designated an economic development district by EDA, which we have since 1993. Through that program, we offer a number of economic development programming, planning, technical assistance, and our revolving loan fund as well. So here are some of those services that I was mentioning that the council provides. As that EDA designated economic development district, the council and staff maintains the region's comprehensive economic development strategy. We're currently preparing our major 5-year update, which will finalize in late 2022. So be on the lookout for any information that we send out to you. We're looking to engage public and stakeholders throughout the next year. Council's revolving loan fund is pretty unique. We're one of only 2 Florida regional planning councils that has a revolving loan fund. Traditionally, we use the revolving loan fund to support small businesses, nonprofits, and minority-owned businesses. But now through the CARES Act, we also have the ability to assist COVID-impacted businesses and other critical economic development needs. In addition to our economic development services, we also provide intergovernmental stakeholder coordination, planning, technical data analysis services, which I have listed there. They could be anything from emergency preparedness, regional development, comprehensive plan review, transportation, resiliency, or any type of GIS mapping or geospatial analysis that your organization might need. So as I mentioned, our RLF, aside from the RLF, we do have our CARES Act business RLF program, which we partnered with EDA to oversee and administer our new $5.9 million CARES Act grant. And that will help us to alleviate sudden and severe economic dislocation caused to smaller businesses caused by coronavirus in the 3 counties that we represent and also Palm Beach County. Of the $5.9 million that we were awarded to lend out, we've lent $4.3 million, and so we have over $1 million to go, but we've lent out, a lot of dollars already. A little bit more information about the loans that we provide. They can be $25,000 to $500,000 at a 3 to 4% interest rate, which is fixed. The term can be for up to 10 years, and it does require a personal guarantee and collateral. They're available for small businesses, sole proprietors, or 501c3 nonprofits located within our region and Palm Beach County. And the RLF funds can be combined with other financial assistance programs like economic injury disaster loans or the PPP loans. But they're not forgivable and they're not grants. And if you have any more questions, please reach out to Jeff Tart, our senior loan officer. So that was a little bit about the council and the economic development services that we have. But before I turn it over to our panelists and moderator, we wanted to set the stage by presenting the latest data from the Florida Department of Economic Opportunity. Each month they release data. Somebody's unmuted again.
That is Mayor Cava's office. If Mayor Cava can mute your microphone.
Okay, sounds good. I really apologize about that, but it sounds like it's okay now. But yeah, basically I'm going to give the South Florida labor market update, which I see us as a recovering economy, but we're in urgent need of support, and our recovery has kind of started lagging. So to start us off, I'll present some of the job growth numbers. Florida gained 960,000 jobs. Can you go to the next slide, please? Perfect. Since the pandemic, we've gained almost 1 million jobs, 15 months of straight growth. Last month, we gained 69,000 private sector jobs, and it was about the same in June. And that number is double in May, so job growth has been on the rise in recent, but that number has kind of plateaued off. On the right, you'll see a breakdown of the industries of the new jobs that we have grown in the past. This is for the past month. According to DEO, 60% of the new jobs in the state of Florida have been in leisure and hospitality. And that's a number that continues to grow, as restrictions have been relaxed and, there's more opportunities for leisure. That's the industry that's been leading the job growth numbers. In addition to growing jobs, there are also growing available jobs posted online throughout the state. Currently, there are almost 550,000 available jobs online, and this has been growing about 3% for the past few months. And then also just consumer sentiment has been increasing as jobs have been growing, as people have more spending power. They're also, they feel better about the economy than they did previously. So, and then unemployment in the state has come a long way. For 11 consecutive months, we had been dropping our unemployment. It's currently at 5.1%. In the previous month, it was 5.0%. So while we've been making a lot of gains, decreasing our unemployment, cutting it more than in half, that recovery has started to stall. But part of this unemployment increase is actually from an increase in the labor force, as we've seen more and more people looking for jobs. So as they enter the workforce, they're looking for jobs, but what we're seeing is they're not taking those jobs, and more jobs are available as well. Hence our bit of a stall. To me, what this tells me is there's a skills and a wages gap, but this is not the worst problem, and this is where the needed support for our ARPA funds will come into play. Across the state at the county level, there really isn't much of a pattern, distribution, or obvious correlation. One slight correlation is, COVID cases per capita. Miami-Dade has been very high in that number and also high in unemployment, and a couple similar instances, but not much of a correlation there at all. And it definitely doesn't capture the recent outbreak in the Panhandle. And I think that there's just a lag. The effect of unemployment will not be captured as early as the up-to-date numbers in transmission. But you can see there that Miami is the most impacted. And you can see that here as well. In the South Florida region, there's been a strong decrease in our unemployment, as we've been making those waves. But again, that slight uptick. Miami-Dade County has actually been lagging in the unemployment recovery. And Monroe County has had actually lower unemployment numbers, which is the only county in our region which is below the state average. So you can see that Broward and Miami-Dade are still, more impacted than the state overall, which has been making leaps and bounds in recovery. In Miami, unemployment is 7.1%, down from 10.1% a year ago. Miami is increasing 50,000 jobs over the past year, a 5.2% increase, and most of those jobs have been in leisure and hospitality. And then there's also been a significant increase in professional and business services. For Fort Lauderdale, unemployment is 5.7%, so lower than in Miami-Dade, down from 14% a year ago. So significant recovery there. The Fort Lauderdale area, private sector jobs have increased 5%, and they've also had most of their gains in leisure and hospitality. Next slide, please. Thank you. For the labor force and employment percentage changes that we've seen in our region, there's been a large increases in our labor force raw numbers, and that's what I was saying was contributing to the unemployment data. But we're seeing that the economy is recovering. We're having increases in labor force and employment. What's interesting in this chart to me is Miami-Dade's decline in labor force. And what this reminds me of actually is that what we've seen recently in the estimated population growth data is that Miami-Dade has, what normally happens is, there's a large influx of immigration internationally into Miami-Dade, and that has not happened in the past year. So the story of, all this domestic migration coming down to South Florida actually hasn't contributed to a population increase, but actually a decrease in Miami-Dade County, because there haven't been enough people locally moving to Miami-Dade or domestically to outweigh those people who are not coming, to Miami-Dade County from international. So that's what we're seeing in this Miami-Dade decline. And what else?
Mark, we're losing you.
In contrast to Miami-Dade, residents from that county moved to Broward instead of Broward. I'm sorry about that. Any better?
Yes.
But yeah, so basically that's what you're seeing with the Miami. There's a population decline there. There's, a total labor force decline. Not necessarily a complete issue, or a threat to Miami-Dade's economy in general. So moving over to giving you a little bit of flavor about the industries.
We lost you, Mark.
PO has released information for June 20 all the way to 21.
Mark, we can't hear you.
Next slide, please.
No, Mark, we couldn't hear anything you said on this slide. Can you hear us?
Yes, I'm sorry. I guess that connectivity issue is coming by.
The slide
But,
here.
right, thank you for changing the slide. This slide is the changes in employment by industry.
All right, we can't hear Mark, so I'm gonna move forward. And
Can you?
no, we can't hear you at all.
Mark, it's a valiant effort, but it's not working. I want to say thank you very much for what you did tell us. We'll possibly circle back around and see if the connectivity is any better. But with us today, we have two very, very good elected officials, one from Broward County, Mayor Steve Geller, and one from Miami-Dade County, Mayor Daniela Levine Cava. And I will ask them both separately though, but I'll ask them both to please do a self-introduction, do as you will your presentation, and I'd like to notify everyone that you will have an opportunity. I'm getting some interference.
Someone from, I don't know if Jeanette or is on, you could mute yourselves if you're on.
If everyone please mute yourselves. That won't work. Thank
It's
you.
okay. No, I muted Mayor Cava because it was coming from her.
Okay. Whoa,
Yes.
you're the guilty one.
Sorry.
So I will notify all the participants that you will have an opportunity to ask questions. All you have to do is type it in the chat, and we'll be finishing up with question and answer of both the mayors. First mayor will be Steve Geller.
Thank you. Hi, Daniela. I'm Steve Geller. I'm the mayor of Broward County, Florida. My background is I served in the Florida legislature for 20 years, 9 years in the House, 11 years in the Senate. I served as a committee chair of multiple committees appointed by both Democratic and Republican leadership to serve as a committee chair. When I retired, I was the minority leader, the Democratic leader of the Florida Senate, which was from 2006 to 2008. I retired because of term limits. I also served as national president of two different legislative groups, the National Conference of Insurance Legislators and the National Council of Legislators from Gaming States. I am fairly unique in that I am both the immediate past chair and incoming chair of the SFRPC, although because you can't have two offices, that made Greg actually the most recent past chair that's still in office, and that is not in another office. When Mayor Cava gave up being the chair of the South Florida Regional Planning Council, and I was first vice chair, I ascended to the chair, but I did not want to be chair at the same time I was serving my one-year term as mayor of Broward County, so I reverted to the first vice chair. And in the next election, pursuant to our rules, will become the chair. I was elected to the Broward County. I was out of public office. I was in the legislature from '88 to 2008. When I tell people I served under Governor Bob Martinez, the general reaction is, who? But I was out of office until 2016. In 2016, I was elected to the county commission, re-elected in 2020, and now I am serving as mayor of Broward County until November of this year. And that's enough of a self-introduction. Mayor Ross, would you like me to say anything now, or will Mayor Levine Cava introduce
If you would please go into your presentation.
Okay. I'm going to speak probably 60 or 70% on COVID, and then move from there to the ARPA fund. First, let me discuss COVID. I want to be clear, I'm against it. But the numbers here are just people. I get the strong feeling don't understand this, because amazingly enough, I still hear people say, oh, it's like the flu. And I don't know what planet they've been living on or what news sources they have been relying on, but no, that's simply not accurate. Let me discuss the way that you measure, because Florida has been using numbers and they are quite candidly unreliable. The reason that the numbers that we use are unreliable are two reasons. Back when COVID was in a declining stage, the governor used the most recent numbers. Once COVID began increasing, he changed the way it was counting so that instead of using when it's reported, they're backdating the data to the date that the incidence occurred or a diagnosis occurred. Either one of those methods is acceptable and correct, but you can't change them depending on whether or not COVID is going up or COVID is going down, and that's what we've done in Florida. The other reason I say that Florida's announced numbers are unreliable, there are two reliable methods of measuring. One is the way that the CDC primarily uses, and the other is the way that the World Health Organizations, Johns Hopkins, Harvard Med, and other groups use. Both recognize that you should be looking at both sets of numbers. The way that Florida measures is a prevalence test. If you use a prevalence test, you test 100,000 people and 6,500 of them are test positive. Well, that's a 6.5 positivity. And that's the way that every state that uses prevalence tests measures, except for Florida. In Florida, what they do is if you have tested negative 3 times in a month, they will count all 3 negatives. But if you test positive 3 times in a month, they'll only count 1 of the positives. That no other state that I'm aware of measures that way. It is inaccurate. It is from what I've seen, it reduces the published numbers by somewhere around 40%, because under that scenario, if you measure 6,500 people and 5,000 of them are new positives and 1,500 are old positives, instead of reporting it as 6,500, Florida would report it as only 5,000. So it's distorting the numbers. The other way of measuring, which I think is generally considered more accurate, is number of new cases per 100,000 of population. I forget, I've been trying to find this, whether it's under 2 or 2.5. New cases per 100,000 of population is in the green zone. 2.5, either 2 or 2.5 to 5 is in yellow. 5 to 10 is orange, and anything over 10 is red. Red is out of control. And these are not impossible numbers to reach. On June 15th, on June 1st, the number was 5. June 15th, the number was 6. July 1, it was 14. July 15th, it was 37. July 30, it was 85. Last Friday, it was 145. And again, that's over 145 new cases per 100,000 population when we're supposed to be under 10. I want you to understand the severity of the pandemic. Those numbers bounce around when you do it on a day-by-day basis. Earlier this week, it was in the 70s. Today, it's 102. The numbers bounce around if you're looking at it day by day, but they're just way too high. Florida has been setting new records on almost a regular daily basis for hospitalizations. Broward County, unfortunately, has been leading the nation almost every day in the number of hospitalizations, not per capita, overall. So Los Angeles County, which has been coming in at number 4, with a population of approximately 4 times Broward, is, you can see that it's not per capita for Broward to have the most hospitalizations over counties like LA with 4 times our population. Miami-Dade in most cases has been number 3. There's a county in Texas that normally comes in number 2. And Miami-Dade has about a third or 40% more population than Broward does. And again, they're number 3, which just shows how bad Broward is. You have to look at who is being hospitalized. There is a complete difference between who is being hospitalized in the first wave back in December, January, and who's being hospitalized now. The people that are being hospitalized today are much younger and much sicker. As a matter of fact, this week we've been told that the largest age cohort of people getting COVID are teenagers. So, we'll discuss schools recently, but my source on that is not overly reliable. I don't mean to insult the Sun Sentinel. It was in the Sun Sentinel newspaper yesterday. I normally try and get my facts from Johns Hopkins or CDC or state official numbers. Again, but you can check the Sun Sentinel yesterday, which said that teenagers were the largest cohort. While we're discussing children, one of the biggest concerns I've had, and that something that has been unfortunately underreported, is the number of pediatric cases, particularly pediatric emergency room visits. In June, there were 36 pediatric emergency room visits just to Joe DiMaggio Children's Hospital. On July 27th, it was 190. By the end of the month, which was only 4 days later, it had gone up to 240. I don't get those numbers on a regular basis. The last time I had them was about August 7th or 8th. It's very difficult. I'm the mayor of Broward County, and I find it extremely difficult to pry this information out of some of the hospitals, which I find extremely disconcerting that I don't have free flow of information. But it was clear that the number I think it was 8 or 9 days, we were already at close to 200. So the numbers are dramatically increasing. This is children going to just Joe DiMaggio Children's Hospital with confirmed cases of COVID. Those numbers should scare everybody here. There is one minor silver lining in the fact that COVID is so horribly bad in South Florida. It's that it is scaring people that our vaccine numbers are going up. They have been going up pretty substantially. So I know that at one point we had peaked at about 100 here just in Broward at about 175,000 cases in 1 week, vaccinations. We were under 10,000 about 4 or 5 weeks ago. Then they went up the following weeks to 16,667. Then they went up to 26,434. Then 2 weeks ago was 28,245. And I don't have the current numbers, but I know it's over 30,000. So it's horrible, the reason that people are getting vaccinated, but at least people are starting to get vaccinated more. And let me just say on that, well, I'll close on that in a moment on COVID. What we have been doing at the county, we have issued orders that all county employees will need to wear masks while in county buildings. The supervisor of elections here has issued order for employees of the supervisor of elections office that they will require either proof of vaccination or weekly negative tests. I've spoken with the county administrator on this since since Pfizer received its, instead of its emergency use authorization, its full authorization. And I am expecting that the county administrator and I will jointly reach a decision on this, on what we will be doing, if anything, by the end of this week. And I expect we will do something on that. I think everybody is aware that the school boards are currently being fined by the Florida Department of Education for daring to make local decisions. I have to tell you, I respect Governor DeSantis. I was in the legislature for 20 years. It's drilled into us, you respect the office of the governor, whoever is in that, whether you agree politically or you disagree, you must respect the office of the governor. However, one area that I respectfully, fundamentally disagree on, and I know that Mayor Cava and Mayor Ross would both agree with me on this, is the governor and the legislature consistently tell Washington, the federal government, don't tell us what to do in Florida, because what works in New York doesn't work in North Dakota. The government that's closer to the people, the states aren't alike, we should be able to make local decisions. Governor DeSantis doesn't want to have statewide mask mandates. I disagree with that, but that certainly is his prerogative. But for the legislature and the governor to say, well, the federal government is too big, they shouldn't be telling us what to do. But the local governments are too small. Like Goldilocks, the state level is just right. And we have all knowledge. It's in the legislature for 20 years, with all respect to myself back then and the current legislature, I can promise you that the state is not the repository of all knowledge. And it is quite frankly hypocritical of them to be telling the federal government that they should let local governments make the decisions, but not on the cities and counties and the school boards, which have certain constitutional rights. Governor DeSantis has been issuing executive orders. We are not emergency orders. We are not, the state of Florida is not currently under a state of emergency. It should be, but it's not, because the governor doesn't want to admit that we're in a state of emergency. Well, if we're not in a state of emergency, you can't issue emergency orders, and there are limits as to what emergency orders can do. Let me close on this, and then I will go briefly to ARPA funds by just saying that vaccinations work. People need to stop getting their medical advice from somebody that they read on the internet that claims that their next door neighbor's friend's dentist dog walker told them something. I don't want to get surgery from somebody who claims that they read something on the internet. And I am urging everyone to tell everybody, as I do at every speech I make, get your medical advice from your local physician, get it from the hospitals, get it from the medical schools, Johns Hopkins, Harvard Med, Stanford, get it from the CDC, the World Health Organization, the National Institutes of Health. Do not get it from anonymous people on the internet. And we know vaccinations work. Please protect yourself, your friends, your family, your community, your country. Do the patriotic thing and get vaccinated. And if that's not enough, protect the children and get vaccinated. I will briefly talk on ARPA because it's very brief. Most of the money for COVID has come from the two prior federal acts. What Broward County has spent the ARPA money on is primarily just economic development. Broward County as a county received $189,652,117,000, which is our first of two tranches of money. The cities collectively in Broward received more than the county did. Of our 189 million, give or take, we put 140 of that directly towards our convention center because we were ready to go start work on the convention center right before COVID hit. It's now been delayed for a year and a half. Interest rates are going to go up, and we need to get to work and issue our bonds and lock in the money before that occurs. We've put $500,000 towards the War Memorial Project, which was delayed by the pandemic. We put another $12.5 million into affordable housing. That's going to be over $20 million from Broward County directly for affordable housing this year. We did money for the City of Hollywood CRA pursuant to an agreement with the county of $3 million, affordable housing, additional specific projects, another $10 million. We put $21 million aside for sewer to septic conversions, septic to sewer conversions. Everybody knows how important that is to preserve the water. $154,000 for internet security software, so just continual upgrades so we don't get hacked and blackmailed. $1 million for broadband and an additional $565,000 for additional mitigation and prevention vaccine outreach. We have essentially used our money from our first two tranches for all of the direct COVID stuff. And the last issue is we are getting requests on a regular basis from some of our employee unions asking for backdated hazard pay. And we don't know what we're going to do on that. One of our problems, and there is no one more pro-union than I am, but you got to figure out where you draw the line. If the janitors who are asking, we're essential workers and they're asking for hazard pay, the people at the airport are essential and asking for pay, and the bus drivers are asking for pay. What other county, and those are not county employees, those are primarily contracted. I get kind of think that all of the county employees that were working in person should be eligible. And at some point in time, why are any of them more worthy than the people working at the supermarkets? So I don't know what we're going to do, but I think it will be very difficult for us to pick and choose. That is approximately 20 minutes, which I was told was my allotted time. So thank you for the opportunity to be here, and I will be around to answer questions.
Thank you, Mayor Geller. I appreciate that. And Mayor Daniela Levine Cava, welcome. And I'll ask you to please do a self-introduction and then a presentation. You're muted. You're muted. You're still muted. Oh, it's me.
She is not muted on her.
We'll get this right.
I think we may have muted her somehow. Can
Yeah,
we see if we mute?
1 second.
Remember, we were getting feedback from her office, so I think that's when you guys may have muted her.
and it's not unusual that you say the most brilliant things when you're muted.
Mayor Kava always says brilliant things, not just when she's muted.
I cannot disagree. Having worked with her, it's always a pleasure. The both of you.
I'd like to move that henceforth we use Zoom instead.
You've got a strong second by me.
It says it's self-muted, so you just, I think, unmuted yourself. Our apologies, everyone. All right, try it now.
Yes, can you hear me?
Perfect.
All right, good, good. I'm sorry if there's background noise here. I was actually at a press conference about Haiti and I'm here in the pastor's office. So I'm a little bit, I'm not in my usual, hence some wonderful background items. But it's a pleasure to be with you once again. I really miss my role on the South Florida Regional Planning Council, and it's delightful to be with chairs and chairs-elects and mayors, and I saw Isabel earlier, so and I know there's many others joining for this important conversation. By way of background, I'm mayor for 9 months. I previously was county commissioner for 6 years, during which time I served as a member of the board and rose through the ranks and was very, very proud to serve briefly as chair. But truly regionalism and planning are extremely dear to my heart. My background is in law and social work. Prior to being in elected office, I founded a nonprofit called Catalyst Miami, originally the Human Services Coalition. I ran the Guardian Ad Litem program, the foster care system, and worked at Legal Services of Greater Miami for many years prior to that. So that's my short history. And I want to address some of the issues that everyone is grappling with, obviously COVID, and now the great opportunities that come from the federal dollars. And I'll say, listening to Mayor Geller talk through some of the horrors of the current situation with COVID, I join and affirm. Clearly, we've worked super hard to get people vaccinated. It's extremely frustrating that people still, now they're ready to go get Regeneron, experimental, but they're not willing to take a vaccine. So I think that's a very, very bad message. We need people to be vaccinated. We know that's the only thing that prevents people from getting seriously ill and not needing Regeneron. And so that's what we need. And fortunately, with the approval by FDA, hopefully we can move forward. In Miami-Dade, we have done very well. Our above age 12, our vaccination rate is over 85%. So I have to say we have done well, but despite that, clearly people are getting sick, the younger, the unvaccinated, and so on. Very, very tragic and dangerous. We have reinstituted mandatory masking, whether vaccinated or not, in all county facilities. And now this past week, we started a testing protocol for everyone who cannot show that they have been vaccinated. Obviously, that's intended to push people to get vaccinated. We haven't yet gone to mandatory vaccination. We're focusing right now on the testing, and we've set up testing capacity. We have a very, very extensive testing and vaccine resource in the county. And we know we have a lot of crossover between Miami-Dade and Broward especially, so we're working collaboratively to meet that need. Now, as for how we've spent this godsend of money, the CARES Act dollars in our rear view mirror, still some of them to be spent, but clearly did have a beneficial role, and now we're gearing up for the American Rescue Plan. You know, our county commission, which is the policy body, I am elected separately, you know, different from other county governments. I don't have a vote. So they're the policy body. They have to approve the general plan. It was approved. It is being submitted to the U.S. Treasury. So much of it will have to come back for competitive bidding, which is what is required under the Act. But I can give you an overview of the categories and the percentages that were basically approved. Also, there's a lot of flexibility. The federal government allows you to go back with modifications. So, of course, we'll do that as necessary. But certainly we have a combination approach of focusing on economic recovery, opportunities to build infrastructure, and dealing with basic needs of people and businesses. We're very hopeful that the infrastructure bill will pass as well. That will give us another shot in the arm. So hoping and planning for that possibility. So just to get into it, let's see here. I'm going through everything that you asked, so I'm not holding back here. I'm going straight to the heart of the questions. We are fortunate in Miami-Dade County to receive $527.7 million from the American Rescue Plan. Obviously an extraordinary sum of money, and one that is going to be spent all too quickly. Also one that has clearly helped us prevent massive layoffs and economic catastrophe in the county. But kind of creates a kind of false narrative like it's long-term, which it's not. So we clearly have to look beyond that to economic recovery and restored property values and property taxes. We are also benefiting, I'll mention, from relocation of businesses to South Florida. I don't know how much they're dividing between Broward, Palm Beach, and Miami-Dade, but certainly we have lots of new tech and other businesses relocating, not necessarily bringing their jobs. We want them to not just bring their CEOs, but also their jobs. But we're working on making sure that that's an economic pipeline for our local residents as well. So we divided that $527 million into 4 buckets. The first is the replacement of revenue. This is a very interesting category, and I'm sure everyone else is looking at this. Not only does it cover things that otherwise we would have to cut because of lack of resources, but they really allow us to cover things that we would have wanted to do, but for lack of resources. So with a little bit of creativity here, we're going to be able to shore up some really important county services. So I'm very excited about that. We are planning to spend a whopping $321 million of that 527 on revenue replacement. So clearly that's the biggest category. It's about maintaining service level, making sure that services are available. And it also allows us to prevent layoffs. Also, we'll be able to move forward with some cost of living increases for our workforce, merit increases and the like. The second bucket is key infrastructure projects. Now, in our case, we're grappling with the septic to sewer problem, the Biscayne Bay fish die-off, the pollution. This is our lifeline. Our economy is our environment is our economy, and we need to be aggressive, much like Monroe County was over the course of several years. And we're following from their playbook, and we're hoping to leverage that with the state ARPA dollars as well. And there's buckets right now available for competition, and we're readying our grant proposals. So watch out, everybody else. We're planning to get the lion's share of the money. Okay, so we're putting in our infrastructure projects, mostly water and sewer resilience efforts, but not exclusively. And then our third bucket is each of our 13 commissioners has a district-specific fund for projects at about $2 million. So 13 times 2, you do the math. And then finally, the fourth budget, which is to support families that have been disproportionately affected by the pandemic. So we're focusing on those census tracts as the ARPA tells us to, where there's been the biggest hit from the pandemic. So low wage workers, those most vulnerable to the ongoing impacts of the pandemic. We're going to be having business grants, workforce training, preservation and development of workforce housing and affordable housing, violence prevention programs, behavioral health programs, and more. So I'll just go into a little more detail about that. On the infrastructure side, bucket 2, we want to help our residents connect to water and sewer infrastructure. We know these costs are extremely high. Individual homeowners might not be able to afford it. So we're looking at ways to leverage those dollars, and that will improve our environment and our well-being and resilience of our home, of our residents. We're also looking at economic and social impact projects in the fourth bucket, 59 million in that category, 15 million for housing, 15 million for violence, crime prevention, 5 million for energy security programs, energy technology, home repairs, weatherization, 3 million to help people catch up on their water bills. We have had a water disconnection moratorium. We have not turned off anyone in the pandemic for financial reasons. 2 million for behavioral health, 2 million for broadband, 7 million for innovative grants to business, 5 million for technology workforce training, and 2 million for certification training. So that's our big picture, and happy to take any questions.
Mayor Ross, you're on mute.
You need to unmute him.
No, he muted himself, so I can't. Oh,
Okay, here we go.
there you go.
I want to say thank you, Mayor Cava, for that presentation. And if we have any questions now in the chat, Aralda, if you'd please let me know. But if not, I'll kick it off with the following. And this is for both of you.
If you don't have any questions, I want to say one quick thing which Mayor Cava reminded me of, which is our rent assistance programs. I need to apologize for those, but I'm not alone. There has been immense amount of monies that have been appropriated by the federal government, and which the local governments have and state governments have been trying to use for rental assistance and assistance to landlords, both. And we have found that we have given out a few percent of the money, less than 10% of the money that we've been trying to get out. And we've been very unhappy, but my research has shown, and Mayor Cava, I want to know if you have similar experiences. This has been a national problem that almost nobody has been able to get money out, because both the landlord and the tenant have to agree. Many landlords don't want to, many tenants aren't applying. A lot of the tenants that would like to apply don't have the necessary documentation or don't know how to get it. We have to put some basic anti-fraud prevention measures in. And on a national level, it has been embarrassing, but nobody, as far as I can tell, has been able to get out the majority of their money that they're trying to. Mayor Cava, what's happening in Dade?
Okay, very good. Mayor Geller, thank you for bringing this up. In actual fact, we've had great success in Miami-Dade County. We're at about 70% of our funds. And I'm very, very proud. You know, I'm a former legal services attorney. I represented people in landlord-tenant disputes, and I was certainly not going to allow people to be evicted during this pandemic when there was protection. So just a few of the things that are different maybe. I am the sheriff. So simply speaking, and it started with my predecessor, Carlos Jimenez, we told the execution of writs. So once the ERAP money came, the Emergency Rental Assistance Program money, we aggressively reviewed every case. We did not depend on the existence of an affidavit in the court file. Because we knew people didn't know about it. We know the courts were not necessarily promoting it. So we took the initiative to review with every household. We also reach out directly to the landlords. We pursue them. We stalk them until we find them. We've had the Homeless Trust call them. I have offered to call them. So Congresswoman Wilson has offered to call them. So we have really left no stone unturned in making sure that this money gets out. We also have partnerships with nonprofit organizations that are tenant organizing groups. They have worked with us to find these households, to communicate with them. And for those who, by the way, are not eligible, we've worked with them on relocation assistance and other social services. So basically, because I am the sheriff and I have control over that, we've worked collaboratively, and our police department has been very happy to do so.
We'll be calling you. We haven't had a lot of evictions, but we've had a lot of landlords that we've set up a mediation program that if you want to do a foreclosure, you must go through a mediation. And the judges have told us that many of the landlords are simply refusing to take the money because, and we can't make. So
no, we cannot make them take the money. That is for sure. But we can be very persuasive. And then the other thing is that there is money coming finally from the state for mortgage foreclosure. I spoke to a company that's been working on that, Indelible. So stay tuned to some of those relief dollars flowing as well. And our court also, with county money, put up a court care mediation program and website.
We've done that. We'll chat. So let's go to other questions besides between each other.
There is one question. There's a couple of questions, actually. I think Mayor Cava just answered one of them, but it says, how will Miami-Dade County likely use imminent infrastructure funding is one. And then the other one says MDC received another $30 million for the BRT in South Miami-Dade. What are those funds being used for?
So imminent infrastructure money, I guess we mean the new infrastructure bill. And we have a list of aging infrastructure, also to look at it in the context of climate change and sea level rise and make sure that the investments are being made in things that have the longest utility. So there's a cost benefit, I think, to every infrastructure project. But so far, with the existing dollars, we're focusing on infrastructure that does create resilience as well. As far as the South Dade corridor, we've started construction on the corridor. We're excited within a couple of years to have a state-of-the-art bus rapid transit system that will be convertible to rail when those dollars and ridership merit.
Perfect. There's another question, Mayor Ross, unless you want to continue. You have other questions?
No, go ahead. I want the audience to have the questions.
Perfect. Can anyone speak to what the cities are doing with their ARPA funds and how that is being coordinated with the county?
I believe that's a Mayor Ross question.
And I do thank you for that. I know that one of the things that we're doing, obviously, is to stimulate the economy. We're going to go out there, and broadband and Wi-Fi is certainly important. That was one of the promises that I actually ran on and was able to fulfill some 9 years later. So we are doing that in all 23 of our parks. But in addition, the infrastructure with the water, we have roadways, and Mayor Geller, you're very familiar with it. Sterling Road tends to flood. It's poor drainage. We're going to be taking care of that with the ARPA funds. We're not waiting for the MPO. We're not waiting for us to do it. We're not waiting for the state to do it. We're using the ARPA funds to get out there and help our citizens. So I think, candidly, we're also going to do the loss of revenue as well. I think that's one of the more important things that will help the cities get back on track. So thank you for that question.
And when Mayor Ross said that, Mayor Geller, you would know it well, we live less than 2 blocks from each other.
Well, if I could add, I do not know the details of what the cities are doing, and I really should know, and we really should be better coordinating. I have put it out there that, if they wanted to match us on certain infrastructure projects, that maybe that could give some additional weight, priority. We obviously have to coordinate around, for example, the septic sewer and many other infrastructure projects. So duly noted, and I'll be asking my League of Cities to share and get on and talk about how we can be more, CARES Act was a big fight in Miami-Dade County because the county got all the money and was supposed to distribute it to cities. And it took a little while to work that out, and it led to my statement that I would reset relationships with cities as county mayor. We would not be fighting about these things, we'd be collaborating. And then Congress thought better of it and decided to give the money directly to the bigger cities. So it took us out of the equation, but we do have to leverage those dollars to be most effective.
Mayor Cava, someone wants to reconfirm the amount that Miami-Dade County received. Was it 527 million?
Yes, and then there are also other sources of funding. There's money that's going to transportation, a few other pots, and there's competitive pots. So, there's a lot of room here to really benefit our communities.
Remember when I said it was 189 million, that is the first half of what Broward is getting.
Oh,
We will be getting
okay.
a second half next year.
Well, I counted my chickens before they hatched. Yes, half of it is in the bank, but I feel very confident that the rest will be on its way.
Mayor Geller, the same question for you. Somebody says they missed it. A couple of people, actually. How many dollars were given to Broward County total?
Well, 189,652,117 times 2. The 189,652,117 is the amount that we have received and that we have already made plans for. We have not yet made plans for how we're going to spend the additional money that we're not getting for close to a year.
Many are asking if you send these numbers in a PowerPoint, in a presentation, if you could share with them.
I cannot hear a word you're saying.
I could mute. There you go. Thank you. Many are asking if there is a PowerPoint or any slides with the numbers and the information that you gave today that you could share with us.
That was directed towards Mayor Cava, correct?
No, both of you.
Okay. Yeah, I have
All the numbers that you discussed, people are asking if you could share with them, if you have them in a presentation or not.
Yes, if you contact my office right now, they'll send you the one-page breakdown on how we're spending the 189 million plus.
Okay, perfect.
And I'd be happy to share the document that was approved by the county commission. I believe Sean McCracken from my office is somewhere on this call. And, Sean, if you could share that, that'd be great.
Mayor Ross, there's no any other questions on the chat box, so please, you can continue.
I appreciate that. And this question is for both of you. You're obviously familiar that the Delta variant in South Florida has unfortunately suffered a re-emergence of COVID to levels that you haven't even seen in the worst days of the pandemic. How will you use the ARPA funds to address the immediate threat of the Delta variant and mitigate its impact?
Well, if I could start.
Yes.
We don't really need to in the short term use ARPA for that because we have extensive eligibility for FEMA funding. So, we're using FEMA for testing, vaccination, disinfection. Yeah, that's how it goes.
And we're really not using almost any of that. We've added 565,000, which is a third of 1%. But remember, this is the third program from federal government. We took most of the first and a lot of the second and put it directly into buying PPP, setting up and paying for vaccination sites, setting up and paying for testing sites. So those programs are already very robustly funded, not through ARPA money, but through the first two federal grants that we received from the federal government. Now, again, the Delta variant is horrible. It is primarily, not exclusively, but primarily a pandemic of the unvaccinated. People that are vaccinated properly with 2 shots of either of the Pfizer or the Moderna vaccine, or 1 shot of the J&J, are only about 10% of the people that are hospitalized. And when you consider that there's only around 27% that are unvaccinated, 90% of the hospitalizations are coming from the 27% unvaccinated. And additionally, the average hospitalization for someone that's vaccinated, or at least was, as this is last week data, was only 2 days compared to 9 days for the unvaccinated. So the best way of fighting this is just getting people vaccinated. And Greg, I am hoping that the Delta is the last variant, but there's already the Lambda variant in, I believe it's Peru, it's South America. And if we don't stop the spread now, we know it is going to get worse. We know there will be new variants. Right now, our vaccines are effective. At a certain point in time, there will be a variant that our vaccines are not effective against, and we need to reach herd immunity before that occurs to keep these new things, to keep the new variants from occurring.
I thank you. I appreciate that. I have another question around, if no one else is.
There is one question, yes.
Okay, go ahead.
What is your interpretation of ARPA's October 1st, 2022 deadline of at least 75% of ERA1 and ERA2 must be spent in order to receive additional funds and/or use funds for other purposes outlined in the law? Is that how your teams are reading that October deadline?
Well, let me say we are adhering to the deadline. As I mentioned earlier, we're meeting the deadline, and I am sad that other jurisdictions have not. I think it is, as Mayor Geller said, it is pretty standard across the country that people have had a difficult time spending this money. So I'm happy to work with any community and help them move it along. So we could give you some tips perhaps so that it could work.
Mayor Geller.
Can you repeat the question? What was the
What is your
ERA
interpretation of ARPA's October 1st, 2022 deadline of at least 75% of ERA1 and ERA2 must be spent in order to receive additional funds and/or use funds for other purposes outlined in the law?
Since I don't know what ERA1 and ERA2 are specifically, I don't know how to answer that.
I don't know. Rose Whitehair, if you could specify
But
that.
I can tell you that we've already, of the $189 million, that money will be spent. Long before that time, we already know how it's being spent. We're writing the checks. I just lack the knowledge of the ERA 1 and 2 phase definition.
There is another question from Mayor Geller.
Yes.
Does Broward still have money remaining in their first distribution that can go towards supporting social services such as mental health supports and grants to support the nonprofits who are supporting so many throughout the county?
I have no knowledge of whether it's in the first distribution. We have been giving grants, substantial grants, to a lot of the nonprofits. We are in the middle of our budget hearings. We have a final budget hearing next week. Then we will have 2 public budget workshops. Then we'll have 2 public hearings. So we're finalizing the budget process now. There is substantial money in there for nonprofits, but whether that's coming from the first or the second federal package, that I couldn't tell you, and candidly, I don't think it matters whether it's from the first or the second.
Okay, and thank you, Rose. Rose said ERA stands for Emergency Rental Assistance
The ERAP.
Program.
Okay.
Right.
I'm sorry, I'm familiar with the phrase ERAP, but that, okay.
Right, ERA 1, ERA 2, and ERA 1 is under the Consolidated Appropriations Act.
Right.
So her question is, what is your interpretation of that, of the, whatever is stated in the ARPA?
I don't have an interpretation. What I can tell you is this: we had a county commission meeting yesterday where I brought up how unhappy, and several other commissioners brought up how unhappy we are with the slow distribution. This is at least the third or fourth time that this has been brought up at a county commission meeting. Because it was going so slow, we went out and hired a private company to work directly with rental assistance people, that people requesting rental assistance that didn't have the ability or didn't want to do things online. We've instructed them to go out to people's homes where necessary, to work with them, to try and help them through the process of obtaining the required documentation. Remember that if the county spends money improperly on things that are not qualified and the federal government doesn't audit, the people that would have to repay it is the county, not the individuals. So we are being careful on that. The second rental assistance program had a lot of ties on it. So it was only available to people earning certain income levels. They had to prove that their loss of income was caused by COVID, was COVID related. So there does need to be certain documentation, and a lot of the people applying simply didn't have or didn't understand how to hire that, and or how to obtain that, and that's why we hired an organization to work with them. So we're doing everything we can.
There are no more questions from the public at the moment, Mayor Ross.
Okay, then let me ask you both this simple question. If you would, what measures are you considering with the ARPA funds to make both Miami-Dade and Broward County more resilient in the future when facing a similar such crisis? Mayor Cava.
Thank you. So I think the economic development aspect of the plan is obviously it creates jobs in the short term that build infrastructure. Those are good jobs, but the projects specifically are about physical resilience, whether it's septic to sewer or building housing or other things that make our community more resilient. The economic
Mayor Cava,
development.
if you put your phone away from the AC.
Okay. All right. Is that better? I'm sorry.
Much
Yes,
better.
much better. Thank you.
Okay, yes. So just that our projects, infrastructure projects, are all organized around environmental, physical resilience. Our jobs and people supporting programs are around helping people to be more resilient. So I would just say pretty much everything in our plan is about resilience of one sort or another.
And thank you, Mayor Keller.
As I have said repeatedly, you cannot just look at the ARPA funds. We are spending almost all of the ARPA funds on 3 pots of money. The largest is the convention center, which was delayed, which our county economic people have said if when we finish the convention center, that will attract massive numbers of jobs to Broward County. The second area that we're putting a lot of money in is affordable housing. And the third area that we're putting a lot of money in is septic to sewer conversion. Those three areas take up probably 95% of the budget. Now, if you're talking about what are we doing to, in general, make it more resistant from against future pandemics, I can discuss that, but not if you're looking at just doing it from ARPA funds. So in general, I'll use our port as an example. Our seaport is one of our biggest generators of jobs. In a lot of seaports in Florida that have relied almost exclusively on cruise, they've been completely devastated because there haven't been any cruises. Broward has, and we've been working to strengthen, a well-diversified port industry where we've been shooting for roughly 1/3 passengers, 1/3 cargo, and 1/3 petroleum. That we're expecting over the next number of years that petroleum shipments will go down, obviously. But we've also now 17% of our port income is coming from rent at the port. So we've diversified the port so that any future pandemic will not hurt us quite as much. We've strengthened issues at our airport, again, another one of our largest economic generators, to ensure, but not just out of ARPA funds, to ensure that we will have more ability to interdict passengers at the airport that might be carrying the pandemic disease. We have been working with our medical community to strengthen the medical community, which, one of the problems is the just-in-time philosophy that a lot of manufacturers have doesn't really work with healthcare, because you want to ensure that you have enough healthcare, so not just for normal times, but if there is a pandemic, that you can deal with issues like that. But again, that's why I had said most of this is not being done with ARPA funds. We should not be focusing on 1 out of 3 projects when, again, the majority of our funds have come from the first 2 federal programs.
I thank you. And I truly want to say thank you both, Mayor Levine Cava, Mayor Steve Gella. It has been a pleasure. It has been thought-provoking and a lot of really good information coming forth. And I do want to say thank you to the South Florida Regional Planning Council, Mark Cassidy, and Geraldo for handling the most difficult of internet problems. So thank you all again, and for all the participants, looking forward to the next webinar. Thank you all.
Yeah, thank you. If you don't mind, everyone, there will be a survey after this. We'd greatly appreciate your opinion as we're striving to get more programming in the future. We want to hear your feedback and your opinion. And I also wanted to personally thank Jeanette, Mayor Cava's assistant, Marsha and Barbara, Mayor Ross's and Mayor Gallus's assistants, for being wonderful to work with, and we made this work. So thank you so much to everyone. All right, thank you.
Thanks so much.